How to stop daily stomach aches for teens. A stomach ache is pain or discomfort in the abdominal area. Stomach aches are experienced by almost everyone over the course of their lifetime, and some experience them more frequently than others. There are a number of possible causes for a stomach ache, ranging from eating the wrong food to more serious health concerns such as appendicitis. Given that frequent stomach aches can be a sign of a serious medical problem, it is important to know how to find relief as well as when you need to contact your physician. Part 1: Relieving stomach aches with medicine. 1. Consider over-the-counter children's drugs with medical advice. There are a number of medicines that are available to purchase over the counter that will help stomach aches. However, it is important that you take the right medicine for the right symptoms. Before purchasing a medicine, consult a doctor or pharmacist and follow labels exactly. Child versions of medications are safest for teenagers as well. Note that if you experience daily stomach pain for several days in a row, you should call your doctor and schedule an appointment to be seen. Prolonged stomach pain could be a sign of a serious health problem. 2. Take a non-aspirin pain reliever for general stomach pain. Aspirin-based pain relievers can be harsh on the stomach and even cause bleeding, so avoid taking aspirin specifically. Ibuprofen and naproxen can be irritating as well. Instead of these options, take acetaminophen to relieve stomach aches. For general stomach pain, call your doctor if it persists for several days or begins to worry you. Aspirin should never be given to children or teenagers unless prescribed by your doctor due to the risk of Reyes syndrome, which can be dangerous. 3. Take an over-the-counter antacid or acid reducer for heartburn. Examples of antacids or acid reducers include Zantac, Prilosec, and Nexium. Heartburn will feel like a painful burning sensation in the chest. It will usually occur after eating or while you are lying down. It is caused by acid buildup in the stomach. An over-the-counter antacid or acid reducer will cure most cases of heartburn. If you continue to experience heartburn for more than 2 weeks while on over-the-counter medicine, or if your pain is severe, you have vomiting, or you are unable to eat due to pain, call your doctor to schedule an appointment. Note that antacids containing aluminum can cause constipation. Also, antacids containing magnesium can cause diarrhea. Read labels carefully. Adult Pepto-Bismol, kaopectate, bismutrol, and some other drugs marketed for heartburn contain bismuth subsalicylate. Like aspirin, this drug can cause a dangerous condition called Reyes syndrome in children and teens. Do not take it without a prescription, especially if you might have the flu or another virus. 4. Take a laxative or stool softener if you are experiencing constipation. Constipation is defined as having infrequent bowel movements or difficulty having a bowel movement. Generally, this means less than 3 bowel movements per week. Constipation is relatively common, but for some it can cause stomach pain and discomfort. A laxative or stool softener can help relieve discomfort. Check with your doctor or pharmacist on which medication to try. If your constipation continues for 3 weeks or longer, call your doctor to schedule an appointment. You should also call your doctor if you begin to lose weight or see blood in your stool. 5. Try acetaminophen, ibuprofen or naproxen for menstrual cramps. Choose one of these medicines and begin taking it, as instructed on the bottle, as soon as bleeding or cramping starts. If these medicines do not work, your doctor will be able to prescribe a stronger medicine for you. Part 2: Relieving stomach aches with herbal remedies. 1. Try drinking a cup of herbal tea. There are several options to choose from. You can drink a cup of herbal tea after each meal to help settle an upset stomach. The following 3 types are worth trying. Chamomile tea contains an anti-inflammatory agent that can help settle an upset stomach. You can pick up chamomile tea at almost any supermarket. Try having a cup of tea after meals to settle your stomach. You should drop the tea bag in hot, but not boiling, water, so as not to destroy chamomile's active ingredient. Mint tea is a useful remedy for gas, bloating, and indigestion because it works to relax stomach muscles. Peppermint tea is available at most supermarkets, but you can also use fresh mint leaves. Simply drop the leaves in hot water and let them sit for 5 to 10 minutes. Enjoy this drink after meals for best effect. Make yourself a rice tea. Rice tea is simply rice, water, and honey. Boil half a cup of rice in 6 cups of water for 15 minutes. Next, strain the rice out of the water, saving the water in a bottle. Add a small amount of sugar or honey to the water and drink warm. Rice tea has been shown to help settle upset stomachs. 2. Try a mix of yogurt and fruit juice. Yogurt can help speed up digestion because it contains active cultures. Mix yogurt with fruit juice for a healthy snack that will aid digestion. Try 1 part yogurt, 1 part juice. Carrot, apple, and peach drinks work well for indigestion. Avoid acidic fruits such as orange juice, as they can be harsh on an upset stomach. Yogurt labels will note if they contain active cultures. Be sure to only buy those with active cultures if you are using it to help with a stomach ache. 3. Drink apple cider vinegar to ease indigestion. Try mixing a tablespoon of apple cider vinegar with 1 cup of warm water and a tablespoon of honey. This will help to reduce cramping, gas, and even heartburn. 4. Eat ginger. Ginger has been used for thousands of years to settle stomachs. Studies have shown that it is the anti-inflammatory properties in ginger that are so effective. Ginger can be taken fresh, in ginger capsules, ginger chews, or as ginger ale. 5. Try placing a heating pad or a hot water bottle on your stomach. For maximum effectiveness, the pad or bottle should be around 104 degrees Fahrenheit or 40 degrees Celsius. The heating pad or hot water bottle works by activating heat receptors deep in the body which, in turn, cause your body to not feel as much pain. This treatment is particularly recommended for menstrual pain. Part 3. Eliminating pain with lifestyle changes. 1. Avoid certain foods. Each body is different, so it can be difficult to give general advice about what foods should be avoided. When you eat a certain food, pay attention to how you feel afterwards. By doing this, you will soon be able to pinpoint what food or foods are causing problems. Talk to your doctor to see if you may have an allergy to a certain food, gluten sensitivity, or celiac disease. Be particularly mindful about the following foods. Processed foods, including fast food, white bread, sausage, donuts, hamburgers, and potato chips. Dairy products can cause stomach aches in some people, especially if they are unknowingly lactose intolerant. Try staying off dairy products for a week to see if there is improvement, or try a soy-based milk. Spicy and greasy food can irritate the stomach and should be avoided if you are experiencing stomach pains. 2. Eat healthy foods and drink water to help with belly pain. The best foods to help with a stomach ache are high in fiber. Your stomach aches may actually be caused by a lack of fiber in your diet. It is also important that you drink water, approximately 2 to 3 liters per day, 9 to 13 cups, is the recommended amount. Foods high in fiber include fruits like bananas, vegetables like broccoli, and many whole grains. Prunes, cherries, raisins, and apricots are particularly effective. These foods will help with regular bowel movements and prevent constipation. 3. Eliminate foods that cause gas. Healthy foods like beans, broccoli, cabbage, and yogurt make gas in your stomach and can cause stomach pain. Eat these foods in moderation. To help prevent gas, chew these foods, and others, thoroughly, and do not swallow too quickly. Drinking ginger ale can relieve stomach aches caused by gas. After you drink, you can try to burp or pass gas to relieve pressure. Over-the-counter gas X may also help. 4. Avoid overeating. Overeating can cause discomfort and stomach pain, even if you eat too much of a healthy food. Try not to get all of your calories in 1 or 2 big meals. Instead, spread out your calories in 3 meals and 1 to 2 healthy snacks. To ease the load on your stomach, here is a detailed breakdown of how many calories should be consumed by teenagers daily. 14 to 16-year-old male should have 3,100 when active or 2,300 when not active. Female should have 2,350 and 1,750, respectively. 17 to 18-year-old male should have 3,300 when active or 2,450 when not active. Female should have 2,400 and 1,750, respectively. 5. Avoid alcohol. Teenagers should not be drinking alcohol, but if you are, it could be a cause of stomach aches. Alcohol increases the amount of acid your stomach produces, and can lead to ulcers, acid reflux, and other issues. Alcohol can also cause vomiting and diarrhea. 6. Reduce stress and anxiety. Stomach aches can be caused by stress, anxiety, or depression. Try to reduce your stress level. Try exercising for 30 minutes each day with a long walk or jog. You can also reduce your caffeine and sugar intake, which can both lower anxiety and help your stomach feel better. Consider talking with a counselor if you are dealing with a lot of stress or anxiety. 7. Get plenty of rest and live healthy while having menstrual cramps. If your stomach pains are caused by menstrual cramps, you will want to have plenty of rest. In addition, you will want to avoid alcohol, caffeine, and smoking. Part 4. Knowing when to seek medical attention. 1. Understand that stomach aches may be serious. The use of medicines, herbal remedies or lifestyle changes are not substitutes for medical care. Given that stomach aches can point to serious problems, it is vital that you know which symptoms to take seriously and know when to see a doctor. 2. Visit the emergency room immediately with severe and unrelenting pain. If you are experiencing severe stomach pain that makes you unable to sit still, or if you need to curl into a ball to find relief, you need to visit the emergency room. This is especially true if the pain is on the right side of your abdomen. You should also visit the emergency room or see your doctor right away if you have any of the following symptoms: stomach pain with bloody stool, persistent nausea and vomiting, skin that appears yellow, swelling in your abdomen, or tenderness in your abdomen. If you have stomach pain after an injury or car accident, see your doctor right away if you have stomach pain and suspect you may be pregnant. 3. Call your doctor if you have stomach pain lasting several days. If your stomach ache persists for a few days or begins to worry you, it is time to see a doctor. You should also call your doctor as you have heartburn that lasts for several weeks with no improvement from over-the-counter medicine. Also, call your doctor if the stomach pain is accompanied with fever and headache, poor appetite, weight loss, or pain with urination. 4. Call your doctor if you have cramps associated with menstrual pain that last longer than 3 days. You should also call your doctor if cramping is severe. Warnings. Always read medication labels thoroughly for safety information before you take them. Aspirin and bismuth subsalicylate, which is found in adult Pepto-Bismol, among other drugs, can cause a dangerous condition called Reyes syndrome in teenagers and children. The risk is highest when the user has a virus, so it is especially important to avoid these drugs if you have a fever or other signs of infection.